I didn't ask, and she told him, they're not supposed to ask.
Hi, how are you? Good to see you. Welcome to this new Ohlone Student Health Center. This is a treat for me to be sharing with you our new space after being in the trailers for 14 years. We moved in here in July and are very excited and happy with the space and the amount of services that we can now provide. I'd like to introduce you to our secretary. She's really the manager of the office and takes care of all the business at hand. Janet Kihas.
Hello.
Janet has been with us for almost 12 years, and she's actually my right hand and my left hand. I don't do anything without asking her, so she's really an integral part of the office. We've got Band-Aids and Neosporin. We always have Tootsie Pops. We have Scantrons. You just have to ask for them. And then we do have over-the-counter medications such as Tylenol, Advil, Motrin, cold medication. It's just in a little dispenser, but you just have to come and ask Janet or whoever's at the front desk for a little token. It doesn't cost you anything to do that. And then you can do that. We've also got some thermometers, reusable thermometers that you can take. And we have feminine hygiene products, so if girls need something when they're on campus, they can come in. The most popular item that we have, however, are our condoms, and we do not charge for those, so you just have to come in and help yourself. They're right there. We do have a piggy bank, however, if somebody feels so inclined to donate money for condoms, that's great, because we order about 1,000 condoms a month. This is the clinical side of the health center. We have 3 main exam rooms, and the services that we provide are primary care services. So if a student is sick, has a rash, an ingrown toenail, they can come in. It doesn't cost them anything to be seen. Students pay a $17 student health fee for fall and spring, and a $14 student health fee for summer, and then that covers them coming in to see me as many times as they need to do that. We do charge we have some charges with the Student Health Center, which include immunizations and lab work if they want a cholesterol done or a complete blood count done, or we're checking the liver function test. But we just charge what it costs us. We belong to a council connection group that is for nonprofits, and Quest gives us their cost on the lab work, and then we just carry that forward for the students. I'd like to introduce you to Jessica Lopez. Jessica's our medical assistant, and she takes care of all the back office things, scheduling patients, setting patients up in the room, helping with pap smears, tracking immunizations for the health science students. And then we have a treatment room here that we're going to set up as a massage room with a massage table, and hopefully be providing acupressure treatment, maybe massage, maybe some physical therapy, those kinds of things. And I'm going to take you into this room. This is my favorite room. This is my minor surgery room. I have made do with really minor facilities when I want to do something, like if I'm removing a mole, or if somebody has a laceration, or we're freezing warts on your hands, that we didn't have facilities that were pretty adequate for that. So come on in and I'll show you my favorite room. This room, the architects got behind me 100% because I told them the barriers that I was having providing treatment for those kinds of things, and so they designed this and set this up for me. So I have a minor surgery light that I can turn on and focus on whatever area I need to focus. I previously had a swing arm lamp that would keep falling down, so I was holding it up with my shoulder and suturing, or my patient would hold it up for me. And so this is really a treat to do that. Now my patients just want to play with it and pull it around while I'm doing the surgery. And now I'd like to introduce you to Rosemary O'Neill. Rosemary is our personal counselor and life coach, and has been with us for almost 5 years. And her office is there, and she remains extremely busy. We have to turn people away because she's such an effective counselor and life coach. And we will be doing a feature on Rosemary later in one of the other magazines, so that you can see more about what she does and what kinds of things she offers to the students.
Thank you, Sally.
You're welcome.
I so appreciate that, because you know how happy I am to be here working as a life coach and a counselor for our students, because it always helps to have someone for students to talk with, and I'm really happy it's me.
Hey, welcome to the Student Health Center at Newark. I'm so glad you stopped by. So this is our other health center that we opened in September, and we're in the middle of an H1N1 flu vaccine clinic right now, so we've rearranged some of the stuff, but we have, as you can see, we have over-the-counter medications. So we've got aspirin, Tylenol, cough drops, Band-Aids. The Student Health Center is open for business on Monday mornings from 9 to 12 with Rosemary O'Neill, who I'd mentioned before, who does mental health counseling. And then I come over on Monday afternoons from 1 to 6 and Tuesday morning from 9 to 1 to do primary care services, physicals, immunizations, and those kinds of things. We do modified services here because we aren't completely set up, but we're certainly happy to see students from Newark so they don't have to drive over to the other campus. I'm so excited. I'm so pleased with Student Health 101, and I hope that this is useful for you. I look forward to starting a new semester in spring and February, and we look forward to seeing you. Please, if you've got any questions, come by the Health Center. We're in the Building 7 on the 3rd floor, and we're happy to just chat with you. You can always reach us by email at studenthealth@ohlone.edu, and I'm happy to answer questions, whether they're health questions or just general questions, and we look forward to seeing you in the spring.